Ideal Pediatrics, ba-da-da-da-da-da. IdealPediatrics.com.
Hi, Dr. Joe Cangas with Ideal Pediatrics. Today I want to talk about telemedicine. I've seen a lot about telemedicine in the news. I see it on Facebook. I get emails asking me to join groups and perform telemedicine. I've even heard recently about virtual medicine clinics being started in our own community here in St. Louis. Now, how do I explain how I feel about telemedicine? I think there are a lot of great advantages to telemedicine. The bottom line is it's convenient, and that's what everyone's looking for. That's why we started walk-in hours in the evening. It's about convenience. If you can't get in when you need to get in to see your doctor, what are you going to do? You're going to go to the urgent care, you're going to go to the ER, and what's going to happen? If you go to a pediatric ER, you might see a pediatrician, and you will there. If not, you're not sure who you're going to see and what kind of care you're going to get. There's plenty of great docs and nurse practitioners and physician assistants who work in ERs and urgent cares. However, there's also some who just prescribe antibiotics. And you don't know who's working the night that you go. So access to quality care is to me more important than convenience. I understand for some parents and some people that convenience really comes first, but I'm here to talk about why I hate to see that and why I hope that you'll choose to see your primary care provider when at all possible. So a lot of these programs offer apps, computer apps, phone apps, to where you push a button, you make an appointment, usually within 30 minutes you get to talk to a doctor. And what are you going to talk to them about? In those situations, a lot of people are calling about sore throats, upper respiratory infections, ear infections, things that they think they need treated for, or they want to know if they want to be treated for. Unfortunately, I have seen, just heard at this meeting I went to yesterday, dad says he's in Florida, child's got an earache, they call, 30 minutes later they have a prescription from the pharmacy. How awesome is that? It's pretty awesome, except for the standard of care there was not met when the ear was not looked at. Most of the time, parents are right. My kid's ear hurts, they have an ear infection, they need antibiotics. I look at the ear, it's infected, they need antibiotics. But the 10% that I look at those ears, and they're good, healthy ears, and that is not the reason for their pain or discomfort, that child getting antibiotics would not be appropriate care. And the only way to know if a child needs antibiotics is to look at that eardrum. Same with sore throats, same with urinary tract infections, same with sinus infections, same with bronchitis. A lot of those things are simply viruses that, unless you actually evaluate the patient or do some testing, you can't give a good high standard of care. You just can't do it. So when can you use telemedicine? I have some great thoughts in mind for our practice. Sometimes ADHD follow-ups, obesity follow-ups, chronic care follow-ups for things such as asthma. You could use it in dermatology. There's a great clinic going on right now with Mizzou where they offer dermatology appointments via Skype or a similar method. And what a better way? All you need to do is see the skin, not all, but a majority of the time that's all you need to do. So that would be a great thing to do. There are great outreach opportunities, places that don't have access to care, don't have access to doctors. So you have a rural area, they have a clinic that's part of the hospital, a nurse evaluates, gets the vitals, sets the person up in front of the camera, and shares information with the doctor who then can evaluate. But someone has taken vitals, someone has given the care. They even have school clinics to where there's an otoscope, which you look at the eardrum, and the nurse can put that in the ear, the doctor can see the image on their screen and diagnose an ear infection. That's an excellent way, but do we all have those in our homes? Can I send one of those home with all of my patients and offer them that great service from my clinic? I simply cannot, and maybe someday they'll be over the counter and we'll all be able to do that, and I think that would be great. But I feel like doctors are giving up everything they went to school for. You went to school to learn to give quality care and to follow evidence-based medicine. Giving antibiotics over an app is the exact opposite of that. So I hope you'll understand my standpoint. I hope you will see your primary care provider when you possibly can. I hope you understand that I love convenience as well, and I would love to sit at home with my baby and answer your questions and give you your antibiotics and get paid while staying at home. But sometimes we have to have inconvenience at the expense of having good quality. So thank you for your time, and let me know if you have questions in the comments below. I'd be glad to answer them, or a private message and I'll reply.
Ideal Pediatrics, ba-da-da-da-da-da, where we treat your children